Good morning. I'd like to welcome everyone to the final installment in our Child Health in the 83rd Texas Legislature webinar series, where today we look back and recap what happened in the 83rd legislative session. Today we're going to be highlighting the good, the bad, and the ugly in regards to child health from this legislative session. My name is Deanna Helsher, and I'm the director of the Michael and Susan Dell Center for Healthy Living and the John P. McGovern Professor in Health Promotion and Behavioral Sciences at the University of Texas School of Public Health, Austin Regional Campus. We've recruited a very special guest for our discussion today, but before I introduce him, I would like to take care of a few housekeeping chores. First of all, our webinar today is being recorded, and an archive will be made available on our website, which is msdcenter.org, along with a PDF of the presentation slides tomorrow, so on Thursday. During today's webinar, we encourage you to ask questions via the chat box, which you can access through the control panel at the top of your screen. Make sure that you send your questions to all participants so that they can see them when you write them down. You can type in your questions at any time, but to keep us on schedule, we'll try to hold off on answering them until the question and answer portion at the end of the presentation. I'd like to tell you just a little bit about the Michael and Susan Dell Center for Healthy Living. We conduct research and provide programs that promote healthy living for children, their families, and communities with a vision of healthy children in a healthy world. Our work fosters improved health behaviors among youth, influences policy and environmental change to support healthy living, and advances professional education and community service. This webinar is one example of the ways in which we encourage professional education and provide a service to the community. You can find out more about our center and our work on our website, msdcenter.org. And since you're obviously here because you're interested in health policy, I recommend that you check out our Healthy Living in the 83rd Texas Legislature Bill Tracker tool, which you can access from our homepage. This tool has provided a comprehensive recap of everything we'll be covering today, and it includes additional resources from both the center and other organizations, and lots of information. So today I'm excited and delighted to introduce our distinguished guest for the webinar. Joel Romo is Senior Director of Governmental Relations at the American Heart Association Southwest Affiliate. Joel has over 20 years of legislative experience and works on behalf of the American Heart Association, shaping and promoting policies at the local, state, and national level to advance the American Heart Association's battle against cardiovascular disease and stroke. Romo's lobby team was named as the number 3 nonprofit lobby team at the Texas Legislature by Capital Insight in 2006 and 2007, and number 6 in 2013. Joel is really a fantastic person to have advise us on the legislation and kind of tell us the inside story and what we can do to improve during the next legislative session. So welcome, Joel.
Thank you. Thank you for having me today.
So to begin with, let's talk a little bit about the successes in child health during the 83rd legislative session. In student fitness, there were several bills that were passed. Senate Bill 1 allocates $5 million to fund the Fitness Grant program for the 2014-2015 biennium. This is particularly for physical activity assessments and related analyses. And then House Bill 1018 requires campus improvement plans to include goals to increase physical activity and improve fitness among students. So starting with Senate Bill 1, Joel, what does this $5 million fund exactly?
Sure. Well, I think one of the goals of the funding that was secured with SB1 was to help school districts implement the fitnessgram and update software as needed. Throughout the session, some of the lawmakers heard repeatedly from smaller school districts about this being an unfunded mandate. So with the help from the governor and Dr. Ken Cooper, this funding was advocated for and eventually made it into the final bill at the conference committee report.
So that really should help with implementation of FitnessGram then.
Absolutely. It'll provide some grants. They'll have to apply through the Texas Education Agency and demonstrate the need for the funding for the different funding requests. So we equate this to success as well as the continued effort of productivity of the FitnessGram to take place.
So talking about House Bill 1018, what exactly is a campus improvement plan, and why is it important to have goals for increased physical activity there?
One of the things that, my understanding of the legislation, and it's a great piece of legislation that will drive some of the school health advisory councils to be more engaged on developing these campus improvement plans that would recommend everything from shared use of different campuses and parks and tracks and fields, increases physical activity to be required on their different campuses that may not be fully implemented. And there's a lot of partnering with within the different school campuses and the school district. And so I think a lot of the stakeholders came together realizing this would be a good way to empower the School Health Advisory Council, really make an impact on physical activity and physical fitness, and demonstrate to the schools that there's ways to drive success in addressing obesity and physical activity by creating a plan that could be implemented through the School Health Advisory Councils.
Great. One question in regard with both of these. Why is fitness so important to the American Heart Association?
Well, for us, we know there's data that demonstrates, obviously, the correlation between physical fitness and better academic students. But when it comes to health, we know that we're looking at numbers of 83 million Americans, 28% who suffer from heart attacks. We also see the number of population of heart disease will increase if nothing changes by 40% in our country. And for us, childhood obesity is a policy issue that our organization really aims to drive. And we know that there's tools and there's resources there in schools to impact obesity. It just needs to be carried out. And so these pieces of legislation will help do that. It will help. Our mission, obviously, as mentioned, is to reduce heart disease and stroke. And with these proposals, we'll start seeing those numbers drop, hopefully sooner than later, not only in Texas, but across the country.
Yeah, I think cardiovascular fitness and cardiovascular risk factors are something that do show up among children. So unlike diseases like cancer, you really don't see certain biologic risk factors show up early like you will in cardiovascular risk factors.
We see a lot of diabetes, we see a lot of heart disease in students at a young age now these days, and it's alarming, and we hope this will reduce those signs.
So with regard to food in public schools, we have Senate Bill 376, in which schools in which 80% or more students who qualify for a free or reduced price breakfast must provide breakfast to each student during school hours. So why is this bill important, Joel?
Well, I think there's been efforts. This legislation has, for the last few sessions, there's been efforts to provide the reduced price breakfast to students. Obviously, we know that some of these students, this is the only nutritious meal. Right now, we know lunch is sometimes the only nutritious meal. If we could provide a nutritious meal in the morning, not only will their academic performance increase, but also you would contribute to that physical fitness, that child being better fed, more physically fit. And it's one of those ways to help address some of the concerns of children not getting proper meals at home during the school day.
Yes, it's interesting because breakfast consumption has been associated with healthier weight, interestingly enough. So that seems to be very important to get good nutrition early in the morning.
Absolutely.
So the next bill, House Bill 217, is an interesting one that was passed but then later vetoed by Governor Perry. This one restricts the type of beverages that can be sold to students grades K through 8 during the school day. And just to follow up, Governor Perry said, I support reasonable measures to sustainably improve the health and wellness of Texas students through nutrition. To that end, current Texas public school nutrition policy already responsibly limits unnecessary, unhealthy access to high sugar, high calorie beverages. So he saw this as being a more extreme way to limit that. So just, Joel, what is your take on this and getting the legislation through the House and Senate and then having it vetoed?
Well, I know this is I believe, the second legislative session this piece of legislation has been attempted, and had some great bill authors both in the House and Senate that were determined to make this happen for the benefit of impacting childhood obesity with high-calorie sugar beverages. And, I think what happened this session is the bill obviously was modified through the process. It was, I think it just addressed K through 12 and took out the high school requirement, which then brought on board the American Beverage Association. Those folks tend to carry a lot of influence at the Texas Legislature. I think that would slow the bill down. It's obviously made it through the process, but I think Governor Perry referenced the Texas school nutrition or school public nutrition policy. There are some things they're already doing and implementing some of these healthy eating and healthy beverage requirements. With this, I'm not sure exactly how the public school policy, nutrition policy will completely be already addressing this, but there are some regulatory routes that could be looked at. But we do know that anytime you address a particular product in schools, you're going to have some resistance, not only from the vendors and different food manufacturers, but sometimes also the school boards and school associations. So I applaud the efforts of the lawmakers that got this legislation passed through both chambers and got it to the governor's desk. And we hope to continue working with them on addressing other childhood issues in the upcoming sessions.
Thanks. Now let's turn to CPR in schools and talk a little bit about that. Joel, do you want to review this?
Sure, happy to. What we've been seeing, the House Bill 897 did pass and did become law, signed by the governor this past Friday evening. This is a piece of legislation that we felt could build an army of lifesavers in Texas. We know that students are going to be in those most high visible areas, with whether it be concerts, school events, college campuses. We know that our legislation is always based on science. Our science demonstrates that children from grade 7th up are better to understand the cognitive skills of hands-on CPR and could react faster and know what to do in a situation like this. So House Bill 97 is a real flexible piece of legislation where it requires a one-time 30-minute course on CPR to be as a graduation requirement between 7th and 12th grade. The school district can pick which course the 30-minute class would be put in, and the school district could pick which grade that would be required. It could be as simple as 30 minutes in the gym, bring in all the 9th graders, bring in some volunteer EMS with mannequins, and have the students learn CPR with hands-on skills. And we know that this will, again, create an army of lifesavers. We've seen the stories of students that react and save lives all over the country. We thought Texas would have the opportunity to almost graduate 9% of the country in high school students. So what a better tool to create an army of lifesavers than CPR.
I actually have a story with this. When I was a junior in high school, we were out on the football team was practicing a night practice before school started, and one of the football players was hit by lightning. And so actually the guy I was dating at the time did CPR on him because we were all trained in CPR, and rescued him. So anyway, it's a very interesting story. I actually have a real life situation to bring to that.
Well, that was one of the tools this session. Well, not tools, but one of the great pieces of stories to share in this session. We had a lot of survivors adults and students that were saved by CPR that came and shared their story, whether they testified or made office visits. And folks may remember Matt Nader, who was revived in Westlake, a Westlake football player with an AED. He came and lobbied and talked about how the impact of an AED and CPR was key for keeping them alive. And I think that's what, when lawmakers were able to see how this really made an impact on them, they, the bill passed overwhelmingly.
Good news. So now we're going to switch a little bit and talk about attempts to weaken previous child health policies during the 83rd Texas Legislature. So two that pertain to school health, again talking about FitnessGram, are Senate Bill 684 and House Bill 1156. So these, in the case of the Senate bill, it proposed reducing the frequency of FitnessGram measures. In the House bill, it proposed elimination of FitnessGram. Do you want to comment on that, Joel? How would this be?
Happy to. We saw this trend beginning in the 82nd legislative session. As a member of the Partnership for Healthy Texas and the Texas Public Health Coalition, we came in this session prepared for these type of efforts to repeal school health policies. FitnessGram was one of those that was attempted last session, and this session we actually saw legislation that you see here filed. And some of the mindset was unfunded mandates, burden on schools, what are they doing with the data? And it was more of what we realized is there's a lot of education still that needs to happen, not only amongst lawmakers, but amongst school districts regarding the impact of FitnessGram. So there, Senate Bill 684 made it all the way through the process and got hung up in the counters committee. It would have reduced FitnessGram to only, I think, one testing per grade or per elementary campus. House Bill 1156 would completely eliminate FitnessGram and never made it out of committee. But we know these fights may not be over. We see more efforts of lawmakers trying to undo unfunded mandates, as they call them. So while this session, these legislative proposals didn't make it, we will be prepared again for fighting off these type of efforts in the upcoming sessions.
So one of the things, this really points out to me the need to raise awareness regarding the impact of physical education, healthy students, nutrition, and the need for obesity champions at the Texas Legislature. I know in the past we've had very many champions, and we still do in the legislature. Is there something that we can do to work on this?
Absolutely. Right now we know that what we've experienced being, when I say we, the public health groups, have realized there are a lot of lawmakers that weren't around when FitnessGram was put into place, that don't really realize PE is only one credit in high school, or that there's, we're not up to the 220 minutes we should be in our elementary grades. What we need to do is do more education, and by that is working with our respective volunteers, getting folks to visit with lawmakers in their districts, getting children involved. One thing we've always been excited about doing in the American Heart Association is engaging our Jump Rope for Heart students and having them come to schools, to the Capitol, and talk about the need for PE and how they enjoy PE. That needs to happen a lot more. We can't take it for granted that these lawmakers know that everybody's doing PE, that there's physical activity happening from K through 12. So this is a good time to go cultivate those relationships and share with them the data. Sometimes they don't realize, for every student that may miss a day of school because of an obesity-related illness, that's $40 a day to a school district. You multiply that by 100 school districts, that's a lot of money. So we have a lot of work to do in our end from educating these lawmakers. And keep in mind, you had over 40 new lawmakers in the House this session. So we didn't get a lot of chance to work on all of those folks and during the interim, but now we do. So regardless of what coalitions or organizations you're part of, it's a great time to go meet with these lawmakers, but have them tour school, make them realize that there are students that would like more PE, more physical activity, like to eat healthier meals. And I think that's some of the way we can address some of the pushback.
This is interesting, too, because I think some legislators might not realize that even some chronic conditions like asthma, there's an association with obesity that you might not think of first off.
Absolutely. There's also the one thing that we tried to get going this session, and this, I think we all had our different agendas moving, but one of the things we saw a lot of was lawmakers did resonate with the fact that our children are graduating from high school and they don't even qualify to pass physical fitness tests to get into the armed services. So, when we don't have a military that can recruit students because of their obesity issue, we've got some issues to address, and maybe things like that will attract lawmakers' attention to doing more for our schools and for addressing the obesity crisis in Texas.
Thank you. So now let's talk about what legislation was there but didn't get passed during the Texas legislative session. So in regards to school health, the high school health and PE credits, which you mentioned previously, obviously didn't get restored. We know that there weren't any changes to the frequency of fitnessgram testing, which had undergone some changes with the last legislative session. There wasn't an increase in physical activity requirements for middle school students, and there weren't higher nutrition standards on competitive foods sold in schools. So of these, what do you see as a common element, or what was a lot of the reason for them? Did they just not get very far? Or?
Well, I think a little bit of, it's kind of a mix. We have some great champions on some of these different proposals from lawmakers and stakeholders. We also have lawmakers that were in Austin this session to undo a lot of things. We also had a lot of lawmakers in town that aren't familiar with what they really could do to address physical obesity and physical fitness issues. In terms of health and PE, we did see an attempt to restore the health curriculum with the floor amendments failed, and that kind of gave us a measuring tool of how the votes would fall on any of these other issues. What we know is that lawmakers need to get better educated on these issues and how something like competitive foods could actually impact healthy eating and reduce diabetes, cardiovascular disease, cancer. They need to realize that students actually would like to have some physical activity, and that it's not actually being implemented all the way in middle school. And we need to get back to presidential fitness test that's being done. That FitnessGram is part of that contributing data that helps schools identify those students that meet the presidential fitness recognition. So I think there's a lot of education that needs to happen. I think there's a lot of more champions that we need to build in terms of lawmakers. I think there's some that are willing to go to bat for whether it be increasing physical activity or competitive foods. They just need more time because these issues are very complex to get through the legislative process. You do have a lot of different groups that are going to be opposed to you that you can eventually come up with some type of compromise. So I think, one lesson that we need to take is that we need to start today, getting ready for the 84th legislature, that building these alliances and try to educate these lawmakers and getting some legislation that everybody can file on day one and try to move through this process sooner than later.
So one question I have in regards to the health credit in high school, that's just health in general, correct? Not just nutrition and physical activity.
Correct.
So are other groups supportive of that as well?
We did. We had Tapered supportive of it. We had both health and the PE credits were supported by a laundry list of organizations like the Medical Association, Pediatric Society, Active Life, you name it, Texans Care for Children. The laundry list of supporters definitely outweighed the opposition. The opposition was basically sometimes school boards because of not enough time in the day anymore, and you had a lot of resistance to requiring these types of requirements for graduation when school students are, we had a session right now where they were trying to undo those requirements. So we had a little bit of a complex issue going on.
So on to food policy. This time there was no action on soda tax bills. We do know that there were several bills that were promoting healthier food choices to SNAP recipients, formerly known as food stamps, particularly restricting unhealthy choices, some bills that looked at pilot programs related to that. And then we also had several bills related to accessibility of healthy foods files, And this one was a little bit surprising to me because in the past, these have generally received a lot of support, and we've had several passed within the last few years. So what do you think, starting with the one about accessibility of healthy foods, some of those make good common sense, like using vacant lots, for community gardens. What's some of the opposition to that?
On the accessibility of healthy foods, it was kind of complex if those pieces of legislation didn't pass. You had some great bipartisan support on those, but I think it comes down to fear of the unknown. What are they getting into as far as addressing the food desert issue or community gardens? Is that the role of government with some of the opposition? Then you also had, again, a lot of lawmakers that for the first time were hearing about these proposals and resisted voting on a proposal that would they really had not had time to vet, but also didn't realize how they were going to be scored. There's a lot of scorecards that are held on food issues and personal rights issues in the Texas legislature. So I think the accessibility of healthy foods comes down again to there's a lot of unknowns, how the scorecards being done, and then also feeling that it was a personal rights issues that they didn't need to be engaged in. And I think that could be, I know that for sure is some of the arguments for the accessibility of healthy foods legislation.
What about the soda tax bill, do you think?
Well, in the soda tax bill, we saw that one in 2011, heard only in the Senate Finance Committee and was left pending, and I think in a subcommittee. In this session, there was no hearings. There was a big tax pledge that was signed by, the majority of lawmakers in both chambers. So, even though it's an increase on an existing tax, lawmakers were fearful of increasing the soda tax for fear of being claimed as raising taxes. Yet, in the state of Texas, we know obesity will cost businesses $9.5 billion annually, and will be, by the year 2030, it will rise to $32.5 billion by that year, But so there was tax bills that we knew weren't going to see the light of day because of these tax pledges, even though some of these were recommendations of the Legislative Budget Board and existing agencies to address that literally had been during the interim discussed. So we know that was a driving factor for the death of those bills, and also the beverage industry.
So let's talk about obesity in the built environment. A couple of these, I know the Texas Department of State Health Services had a grant program to support programs and projects related to childhood health, fitness, and obesity prevention, and that was not funded. I know that there was no new complete streets legislation, which really surprised me because the last two legislative sessions, it's received a lot of support. And then finally, Senate Bill 924, this is more of an incremental change that we've had several similar pieces of legislation that have gotten together groups to address nutrition and obesity and hunger and food in Texas. So starting with the complete streets, what can we do to maybe shore that up the next time?
Well, I know the Bicycle Coalition did a phenomenal job of identifying some champions on this proposal. I think the shore up support for the next time around was, obviously gaining that local support, getting those resolutions passed by local communities, city councils, bicycle coalitions throughout the state. But we're still in Texas, where everybody likes to drive their big trucks and across at high speeds in the rural areas. And so I know there is resistance from your rural lawmakers, and there's still some of a good contingency of those in the House and the Senate. So I think they need to continue, and they've done an awesome job of engaging new volunteers and stakeholders, and trying to message that property rights. I know was an issue that kept coming up about this legislation violated that, and I think addressing that issue more with some of the new lawmakers may help them move that legislation around this session in 2015.
I think from our standpoint too, what we can find in research that shows a lot of times what happens when these get implemented. I mean, we do know that they make the environment safer, and safety is a big issue in parents' minds. So finally, talking about tobacco, no action was taken on legislation to make Texas a smoke-free state. There wasn't any increase in age to purchase tobacco products and no increase in the tobacco tax. So it doesn't look like we made much headway here at all.
You know, from the smoke-free Texas perspective, you know, the fight came down in the Senate. We couldn't get the 21 votes to suspend to bring up the smoke-free policy there. In the House, you know, again, we had a bill filed. We had numerous co-authors. We could have moved the bill in the House, but the resistance was the Senate wasn't going to move anything if there weren't 21 votes. So, you know, we did see a lot of local ordinances throughout the state pass. We saw Brownsville, Louisville, and Lufkin in a matter of 5 months, each respectively passed a comprehensive ordinance. So we know there's still local support there. Tobacco products, you know, the tobacco lobby still carries a lot of influence at the local